Good evening, everyone. Thank you for joining me on Facebook Live tonight. We're going to be here with me for the next half an hour, and I hope we learn a lot. I can answer some of your questions. So my name is Andrew Khan, one of the doctors who came together with 6 other doctors way back in 2000 to start IVF Australia. So we've come a long way since then. Tonight, we're going to be talking about complementary and alternative medicine in infertility. So a little bit about who I am. I'm originally from Singapore. I've been here for 35 years now, so quite a long time. So my special interest is on more natural fertility. I travel a lot to infertility units around the world, but mainly in Asia. So I'm particularly keen about how they do infertility in Japan, where it's very, very natural, as natural as possible. And even when they do go to IVF, it's usually very low dose or even natural cycles where they don't do any injections, and they try and collect not many eggs, either 1 egg in a natural cycle or 2 or 3 eggs, and try and fertilize it and then definitely replace 1 embryo. So much so that I actually started a clinic in Liverpool. It's called the Fertility Center. And in there, we actually do very low dose and low cost IVF, where we try to just collect between 3 to 5 eggs, fertilize it, grow them to day 5, and then replace 1 embryo. So we're trying to mimic as close to nature as possible. So which brings us to today's topic. Today's topic is about complementary and alternative medicine. So some people call it CAMP, complementary and alternative medicine. And I'm no world expert on CAMP and infertility, but being Chinese, I do see a lot of Asian patients, and a lot of the Asian patients are on traditional Chinese medicine before they come. Most of the studies say that, in terms of CAMP, complementary and alternative medicine, about 20 to 25% of patients are already on that before they actually seek medical help. So a little bit about, I've already mentioned a little bit about my beliefs, but I believe that when we talk about infertility, my beliefs will actually complement the complementary and alternative medicine. So all we need, and the basis, the fundamentals of trying to get pregnant is we need 1 healthy sperm amongst the millions and millions in normal life. We need 1 healthy egg. We need them to come together, fertilize, create a healthy embryo. So that's the first part. And the second part is this healthy embryo needs to find a uterine environment. So we need a healthy uterus for it to implant, and then it will grow, and then it will become a live birth eventually. So what I feel is that, if we can try and mimic nature, nature is really the best tool we have. If we can try and mimic nature, try and get that, sperm as healthy as possible in terms of lifestyle of the man, don't drink too much, don't smoke at all, if possible, lose weight. Again, age is one thing we can't control, but we know that even in the men's age, we know a lot about the women's age in infertility, but as the man grows older, although we don't get more Down syndrome, we get more other disorders such as autism, autosomal dominant type conditions. So it's better also in terms of age, if you can, then start the family earlier. So that's the men's side. Women's side, again, in terms of before you start a family, much as the same as men, we're trying to get 1 healthy egg. So, all the lifestyle factors can be improved, stop smoking, decrease amount of drinking, healthy lifestyle in terms of your weight. And again, age, we know that is very, very important. Has the problem with eggs in women is twofold. There is a fixed number of eggs that when the woman is born, there's a fixed number of eggs left in the ovary. It's about 2 million. And that number just keeps going down and down and down until you reach the menopause where there is absolutely no more eggs. So unlike men that produces sperm every 3 months, so they make new sperm. So if for whatever reason the man had taking medication, steroid type medication that stopped sperm production, if he goes off it, gets well, he actually makes a new sperm, and it takes about 3 months to make the new sperm. But women is fixed, so they don't make any more eggs once they are born. So that's one reason why women need to if possible, get pregnant earlier rather than later, because the later you leave it, the less eggs you've got. But the second reason, and probably this is more important, is that the quality of the eggs decrease as you get older. So in terms of if you were trying to get pregnant at 20, 23, that sort of age, then you release the better quality eggs, the eggs with less chromosomal damage. And even if when you get to about 40, in the early 40s, you may still have age. So if you do a blood test, like for example, if you go to your GP and you ask for the egg timer test or the anti-Mullerian hormone test to check the number of eggs left in the ovary, yes, that can be done. And the results may be very good. So that means to say that this 40-year-old woman has a very good AMH. There are lots and lots of eggs in her. So she's not that worried that she's going to run out of eggs. But what the AMH doesn't tell us is that it doesn't tell us about the quality of the eggs. And there's a second crucial issue. There is no test that can test the quality of the eggs. So as the woman gets older, the quality of the eggs definitely decreases. So there's, like more chances of chromosomally abnormal eggs that are released. And therefore, even though she's ovulating and the sperm can fertilize the eggs, the resultant embryos has more chance of chromosomally abnormality. So it will be less likely to implant, so it's harder to get pregnant. And once it implants, it's actually more easy to miscarry because the body recognizes this as a chromosomally abnormal baby and allows it to miscarry. So, the statistics are not good. Once you reach 40, probably like more than 40% of women will miscarry once you get pregnant. And that's just because the embryos are abnormal, nothing to do with, the uterine environment and all. So again, going back to if we can get pregnant earlier, then it's better to get pregnant earlier rather than later. And lastly is the uterine environment. So uterine environment, we're talking about polyps, fibroids, things that grow in the uterus, endometriosis. So these sort of things are environment that, the embryos may be very good. They may be going back into the uterus, but they cannot implant because of the uterine environment. It may also be things as subtle as antibodies. So if the woman has a certain antibodies, that is, yes, the embryos can implant, but the antibodies are attacking the embryo and causing miscarriage, or not allowing the embryo to implant in the first place. But once it implants, a higher chance of miscarriage because the antibodies are attacking the embryo. So this is the fundamentals of fertility, stroke infertility. So if we can, get one healthy sperm, one healthy egg, the uterine environment, we need to get the timing right. So, intercourse must happen around the time of ovulation before it, for this whole thing to work. So what I feel the role for a lot of what we are doing is trying to encourage couples to keep at it, keep having intercourse at the right time and try and catch it so that, if this month you don't get pregnant, you just keep trying the next month, you just carry on. A very common question is like how often do you need to have sex? Do you need to have sex every day, or should you rest 2 or 3 days? The answer is that you must have sex obviously at the time of the ovulation. If you had to choose exactly at the time or before or after, then maybe 1 day before ovulation is the best time. the sperm lives for about 3 days. So if there is sperm in the reproductive tract, so in the vagina, in the uterus, swimming around, it can be there if you have intercourse on Monday. It will still be there on Tuesday to Wednesday. So every 2 to 3 days, if you have intercourse, that means you just have sperm in the reproductive tract all the time. So you really don't have to catch when you're ovulating. So you just have intercourse every 2 to 3 days until, unfortunately, if you're not pregnant, then you have the period. Other than that, if you want to try and time it, then the second best thing is to use these urinary LH kits. Test your urine, either plus sign, smiley face, or 2 lines that show that you're ovulating, and then you have sex that night and maybe the next night, just to be on the safe side. So if you want to time it, but it's really quite hard to try and time it, and you might not be in the mood to have intercourse at the time of ovulation. Okay, the role for complementary and alternative medicine, I feel, is that it encourages couples to carry on natural fertility, to keep trying, and if it's not working, and it gives them some additive impetus to keep trying before they actually seek medical help. Having said that, we're going to talk about different aspects. I've got lots of questions that have already come up, but one of the things that what we are doing, and what we are doing in terms of giving medication to bring on ovulation. So it may be tablets like Clomid, Letrozole, or Femara. These sort of tablets, they bring on ovulation. They are medicine. They have side effects. So we know that there is an effect. The effect is to try and make her ovulate. So some women don't ovulate, especially women with polycystic ovaries. They don't ovulate, they don't have periods every month, and these oral tablets will help them ovulate. So for every medication that has an effect, there's always a side effect. So I always say to my patients that, if there is no side effects, like, if we're talking about traditional Chinese medicine, or we're talking about some herbs, if there is no side effects, there probably is no effect too. So, for it to have an effect, it must have some sort of side effects. The question is what the side effects are and whether we can live with it. So and we move on, and when we move on to oral medication, we move on to injections for what we do. That's even more side effects that we're talking about. But we're not talking about IVF and all that today. We're talking about complementary and alternative medicine. So I'll stop there and I'll start answering some of the questions that have already come to hand. Thank you for your support. I think this has been quite an interesting topic. I think we've got lots of questions even before I started. So the first question I've got is traditional Chinese medicine safe when trying to conceive? Right. Like I said, I get lots and lots of patients that have tried traditional Chinese medicine, and this traditional Chinese medicine, there is a whole range. So moving from simple things like acupuncture right up to herbs that you need to take, and usually relating to the heatiness of the uterine environment that they're trying to manipulate that. So I have a very simple basis. I would say that if it doesn't harm, again, first, all medicine, if it does no harm, then by all means carry on. And like I said, if it helps you carry on trying naturally to have intercourse each month, then by all means try. But by the time you come to see either your GP for referral or see us directly, you probably would have tried quite a while. We're talking about maybe 6 months to a year. That may be the duration, what we call the duration of infertility, or you are a bit older. So if you're in your late 30s, early 40s, then you feel you may not have that much time for the reasons I said earlier on, that you want to try and get on with it. So you've only maybe tried for 3 months and then you want to move on with it. So the question is, if you're going to move on to what we do, which is oral tablets or injections to try and stimulate the ovaries to produce more eggs, should you be carrying on with these traditional Chinese medicines? I have a very simple philosophy philosophy, I think that if you doing acupuncture, then to me, it's got no harm with what I do. So I would have encouraged all my patients to carry on with their acupuncture if they feel up to it, all throughout treatment, even when we are doing ovulation induction with oral tablets or injections, I would say be happy to carry on. Even when we do IVF and we're doing embryo transfer at that time, I'm very happy for patients to carry on with acupuncture. The studies, though, when we talk about acupuncture and infertility, whether it helps or not, have been not very conclusive. So not one way or the other. So some earlier studies showed that yes, all studies showed that acupuncture does help with the mental well-being of the woman as she undergoes fertility treatment. So for that reason, there's no dispute. But then the problem is, does it actually help in terms of pregnancy rate? If let's say we had a group of women that were doing acupuncture, same age, same sort of reasons for infertility, and another group that was not doing acupuncture, and they both went for the same sort of treatment, whether it be intrauterine insemination or IVF. Is there a difference in, say, pregnancy rate? So that's to get pregnant, or is there a difference in live birth rate? So it's not just about getting pregnant. You need to get pregnant and not miscarry. So live birth rate is actually more important measure. And those randomized control trials have varied. Initially, they showed that yes, it may help implantation and live birth rates, but the last big studies, the biggest randomized control trial, that was actually an Australian study done out at UTS Quarry. It was published in the American Journal of Medicine. You can just Google acupuncture, and it was IVF at that stage. Showed that there was no difference in the two groups. But again, like I said, mental well-being of the group that was doing acupuncture was definitely better in the acupuncture group. With regards to herbs, and we can be talking about, traditional Chinese medicine herbs, or we can move on to naturopathy and, what sort of herbs that are given during the time. I would say if you're trying to get pregnant naturally, by all means, try that. We don't know the good, the harm. The studies have not shown that they make a lot of difference in terms of actually getting pregnant, but it encourages the woman, the couple, to keep trying each month. When they actually come to see us and we're giving them either the oral tablets like the Clomid, the Letrozole, the Femara's, or we're giving them FSH injections which are injections to try and stimulate the ovaries, then I would encourage them to cut down on or cut off actually any other medication that they're taking, whether it be herbs or traditional Chinese medicine herbs, because of the interaction. We're not sure about the interaction between the drugs that we give them and their drugs, and whether it will increase or potentiate the effects of the drugs and the side effects of it. So I would say at that stage, once we start our injection, stop. And then once we put the embryos back in, if you feel like you want to go back on it, then that's fine. So, okay, so that's that question. I've got another question on massage. And I'm going to group that question together. So are massages safe when trying to get pregnant? I'm going to group it with what do you think about osteopathic manual techniques to help with infertility? So all of where you are not actually taking any medication into you, I would classify it like the acupuncture group, and I would say I have no problems with it. You can carry on massages, you can carry on osteopathic manual techniques all before the fertility treatment, during the fertility treatment, and even after the fertility treatment. You can also, obviously, before you see us practitioners, when you are trying naturally yourself, go for these massages, osteopathic manual techniques, and I would say back to basic principle. Do it, because if it makes you feel better and it encourages you to have intercourse at the right time each month, then that's the only way you're going to get pregnant naturally, is to have intercourse at the right time each month. The other ways you can help is try and get this healthy sperm and try and get a healthy egg. You try an environment and get them together at the right time. Question about can prenatal supplements help increase the chance of pregnancy? Prenatal supplements, so that term is very broad term. So if we're talking about folic acid, so folic acid, all obstetrician, gynecologists, all GPs will be encouraging women to take folic acid before they start planning for a pregnancy. So at least 1 month, up to some studies says at least 3 months before you actually can plan to get pregnant, because the folic acid does not help you get pregnant, but it does protect the baby from certain conditions, neural tube defects, spina bifida. So that one's definite. All obstetricians, GPs would encourage women to start folic acid. You don't need to buy the brands. Some of the brands are quite expensive. So I think, any folic, especially in Australia, if you go to your Woolworths, your Coles, your pharmacist, and you just ask for folic acid in pregnancy, in Australia, that's all very regulated. It's definitely more than 400 micrograms. A little bit more doesn't matter, but must be at least 400 micrograms per day of folic acid. In terms of, again, prenatal supplements, if we're talking about other things, there are lots of that on the counter. You go to your pharmacist, there are lots of prenatal supplements. And even in some of the brands, you can see that besides folic acid, there are other things in it. And the other things in it, whether it be iodine, vitamin D, all of that, again, all doesn't help pregnancy, but it does it does help with if you are lacking. And in Australia, with a balanced diet, very hard to be lacking in certain things due to dietary intake. So unless you actually, a vegetarian, or you don't take certain type of food, then yes, you can, measure your vitamin D, and then you may have to take supplements for that. But vitamin D, sunlight, iodines in a lot of the seafood that we take. Another question: how does coenzyme Q10 help with fertility? So coenzyme Q, that's a very good question. That's a very, very common question. I think if you Google coenzyme Q10, we know it's an antioxidant. So it is antioxidant. So so that means it helps with oxidative stress in the cells. So all the cells are stressed, and when the cells are stressed because of oxidative stress, because of the workings of the cells, the theory is very good, and that the increased oxidative stress will decrease the quality of the eggs and sperm, and whether these antioxidants help. So in theory, yeah, it should help, and we have it for men too. We have it in the we love the supplements for men. They are antioxidant. They may not be CoQ10, but they are antioxidant. And the theory, again, like I said, it is helping against the oxidative stress. So oxidative stress caused by lots of things. So simple things like smoking, weight, increased weight of the individual, or adds to the oxidative stress of the cells. So I would say, first things first, get rid of that if you can, those risk factors. And then CoQ10, does it help? There's a big database called the Cochrane database. It's a study of all the randomized controlled trials on all the different topics. So if you look at that and you specifically look at CoQ10 in terms of fertility treatment, so you've got to read these things very carefully. But if you look at CoQ10 in terms of fertility treatment, it has not been shown to make any difference in terms of pregnancy rates or live birth rates. So I haven't seen a study based on natural fertility, a proper randomized control, but based on fertility treatment, then it doesn't make any difference there. Okay, let's move on. Okay, I've got from Holden. Thank you for your question. Thank you for your session today. I'm taking thyroxine, Lexapro, Alavit, vitamin D, and letrozole 7.5 cycle. What other things would you recommend for us? I think one of the things I'm trying to pass over to the audience today is more is not necessarily better. So I think, Holden, you're taking a lot of things, and if you need them, then you definitely need to carry on. So like, for example, thyroxine, if your thyroid levels are T3, T4 thyroid blood levels show that you need thyroxine, then you definitely need it. Elevate contains folic acid. It contains a lot of other things besides folic acid. I think in terms of Elevate, I think everyone should be taking folic acid. You don't necessarily have to take Elevate, because anything with just pure Elevate, pure folic acid is enough. If you lack vitamin D, then by all means add vitamin D according to your blood test. Letrozole would be something that you'll be taking to try and make you ovulate. Lexapro, not quite sure what Lexapro is, so I can't answer that question. I need to look it up. Okay, I've got another question. Sarah D, thank you for your question. What do you think of acupuncture before a frozen embryo transfer? Okay, so up to probably 2 years ago, when the studies were quite encouraging for acupuncture, in fact, the studies then showed that if you were going to do acupuncture, you should do it the day before your embryo transfer, the day of your embryo transfer, and the day after your embryo transfer. So these are the best time, because whether you did it 1 month ago, you did it when you started the injections, it didn't seem to change the pregnancy rates. But in the group that did it the day before, the day of, and the day after, there was this study, and quite a few studies around that time, that showed that yes, that actually improved the implantation, the chance of the embryo actually getting pregnant. So that was about more than 2-3 years ago. Then this very big other study came in, the ones in the Australian studies, that showed that in a true randomized control study where they did sham acupuncture. So in one group, they actually did the acupuncture, put the needle in. The other group, so as not to create what we call the placebo effect, they use a needle, but they put it in the different point, not the point that is meant to make any difference, and they didn't actually puncture the skin, but the women didn't know whether she was in the sham group or in the acupuncture group. And in that study, which was the biggest at the time, I don't think there's any bigger study than that. I think it was about 800 odd women that didn't show any difference. So again, this was 2018. Again, there might be studies later on, even bigger studies that may show a difference. So my philosophy is that we're not sure at this point, and if it doesn't do any harm, by all means go. But if you're going to do it, then maybe go to what I was saying, the studies that show that at the time of embryo transfer is the best time to do the acupuncture. Are there any? Julie's got a question on. Hi, Julie. Are there any herbs, food to avoid when trying to conceive? That's difficult, because a lot of the herbs and even food, we don't know what's in them. So I think healthy diet, yes, for sure. Herbs and food. There's nothing specific. A lot of the medicine, especially Western medicine, GPs are very, very sure, what medicines you can't take, your vitamin A's, retinoic acid, all that, that are teratogenic. That means has an effect on pregnancy. We should avoid. A lot of the antibiotics, the tetracyclines, the sulfonamides, we know we shouldn't take. So that one's all going to be guided by your health practitioner, your GPs or your specialist. But the problem obviously is herbs and spices, and then if you extend it to traditional Chinese medicine, where they are boiling natural stuff, whether that's going to harm. I would say I cannot be sure. I think for traditional Chinese medicine that's been around for up teen years, and then they haven't been shown to have any increased chance of abnormality. That's one thing. But the other thing is, what actually are you giving? Is it the same stuff that has been around for a long time? So I would say whoever is providing these herbs and spices, herbs and traditional Chinese medicine, then you should be asking them, are there any, has it been used for, or, we're talking at least, 100 years has there been any increased risk? And then you got to do your own due diligence about that. I think if you got the herbs and spices and then you were looking for exactly what ingredients are, you can go to your doctors, and then they can again, if they know, that's fine. If they don't, they can always research on whether it actually is teratogenic or not. Okay, I've got question from Miranda. Hi, doctor. I'm 5 weeks pregnant. So congratulations, Miranda. I'm 5 weeks pregnant and have been taking Elevit for 1 week. The Elevit is making me constipated. What other vitamins do you recommend I could take? Okay, very good question. Anyway, congratulations again, Miranda. So Elevit is a brand. So and we know you need folic acid, and the jury's still out is if you take a normal diet which is rich in folic acid, whether you actually need supplementary folic acid. So at this point in time, I would say, unless you're not, unless you're very sure you're taking enough folic acid via vegetables, then yes, you can go off your folic acid. But certainly, we need to be taking folic acid if we are not sure. 1 to 3 months before you get pregnant, right up to 3 months, 4, 8, 12. So 12 weeks of pregnancy. So if we got 5 weeks, we got another 7 weeks to take. We don't have to take Elevit. We can take pure folic acid because it may be other things in the Elevit that is causing the constipation. But I would probably ask, did the Elevit cause any problems before you got pregnant? So usually you'll be taking Elevit folic acid before you got pregnant, and was it causing any problems then? So if it wasn't causing any problems then it should not be, even when you get pregnant, cause problems. Pregnancy itself is going to cause constipation because pregnancy is a situation where there's a very high progesterone in your levels, and progesterone tends to rest all your organs. So it's supposed to rest your uterus, so decrease the contraction pains. It's supposed to rest your bowels, so because your bowels are not peristalting as much, so constipation is more common. So it may not be the Elevit, but by all means try and change to another brand of folic acid, and then use other more natural methods to try and relieve the constipation, because it could just be due to pregnancy. I've got a question. Okay, I think I've rambled on too long. It's already 7:30. I've been having a lot of fun, too much fun. But maybe I'll take one last question, and it's about caffeine. So a lot of us drink coffee, and does caffeine intake, first of all, decrease pregnancy potential, and is it harmful after you get pregnant? And unlike alcohol, though, there was a very big announcement. I don't know whether you guys know, but there was a very big announcement about a month ago that said there was a zero tolerance to alcohol. And that's come up from time to time because, a lot of us take a little bit, and before we get pregnant, we say, oh, in fact, well, we probably say that, it's the alcohol that caused the pregnancy. But yeah, so a lot of people say, okay, a little bit of alcohol shouldn't harm. But the Scandinavians have shown that it's actually a zero tolerance to alcohol, that even a little bit of alcohol, 1 glass a day, 1 glass a week, that is going to affect the, intelligence quotient of the child, affect that. So for caffeine, it's at this point in time, not a zero tolerance, 1 to 2 cups a day before you get pregnant, after you get pregnant, isn't going to change anything. So feel free to carry on your cuppa every day. So at this point, I'd like to thank you all for attending, taking out 30 minutes of your time. I would say that if you've got any questions, further questions, please go to our website. We've got a 1-800 number. You can send emails to us, and keep safe. Thank you. Bye.